Welcome to this month's installment of At Home Together. My name is Dr. Jeremy Goodman, and I have the privilege of serving as the Chief Medical Officer of Banner University Medical Center in Phoenix. In this role, I have oversight of quality, patient safety, and clinical care in partnership with the over 2,000 physicians and advanced practice providers of our medical staff. Today's program is entitled, Yes, It Is Brain Surgery, and I am pleased to introduce our headliner for today's program, Dr. Peter Nakaji. Dr. Nakaji is the chair of the Department of Neurosurgery at Banner University Medical Center in Phoenix. He's the physician executive director of our Neuroscience Institute and the physician executive of neuroscience for all of Banner Health. He's also a professor of surgery at the University of Arizona College of Medicine, Phoenix. It's a mouthful. I hope I got them all, Dr. Nakaji. Today, we have the unique privilege to witness neurosurgical procedures performed and narrated by Dr. Nakaji, and to meet one of his truly inspiring patients, Patricia Langell. Dr. Nakaji will be teaching us all a little bit about brain aneurysms, and then we'll have a chance to watch him in action performing the most delicate surgery imaginable. Dr. Nakaji will then introduce us to Ms. Langell, and we'll have the opportunity to hear from her about her experiences following the surgery you will have just seen. We'll conclude by taking some of your questions directed to these two incredible people. Before we begin this evening's presentation, I'd like to provide a few housekeeping details regarding the running of the show this evening. Today's session is being recorded, so our audience is muted, but we still want to hear from you, so please submit questions throughout the program using the chat icon at the bottom of your screen. The questions will be gathered and moderated during a question and answer session towards the end of the program. We'll get to as many questions as we can, and any we're unable to answer will be included in the Q&A section of our resource website. Finally, you've probably noticed that Dr. Nakaji and I are in the studio together without masks. Thanks to Banner's leadership in the fight against COVID-19, we were both fortunate to be vaccinated earlier this year, and we both encourage all of you to do the same. Banner has consistently followed CDC guidance, and our approach today respects that authority. And now, I'm delighted to introduce Dr. Peter Nakaji.
Jeremy, thank you. Well, thanks to all of you for giving us the privilege of spending some time with you and sharing this interesting patient and story. It's my privilege to serve, as you heard, as the neurosurgeon chair of this department here and as the physician executive for neurosciences. And I did want to talk a little about why I came over here to where I really feel is the premier environment for neurosurgery here in Arizona and in Banner Health. You know, we have the opportunity here, partly because of the scale of Banner, because of the number of patients that we reach, because of just the place that the university is going, to really carry out neurosurgery at the very highest level. And through my career, I've always pursued making things better and better, not just doing what we always did before. So today we're going to talk a little bit about that and look at a surgery which is widely considered to be one of the more delicate surgeries that can be done, which is to go inside the brain and fix an aneurysm of the brain, which we'll talk about in just a minute. And this kind of surgery is part of a broader philosophy of making sure that we're delivering the very best neurosurgery in the world on the most complicated problems, but also in a way which is really compatible with Banner's mission. Is we want to make things easier and make life better. So we'll go ahead and move on into the slides, and we'll introduce the problem. So, all right, so what is an aneurysm? Well, you know, this is what it is. This is the definition. It's a bulge or an enlargement in an artery, which is caused when the wall becomes weak and it bulges out. But to put it in context, what we're really worried about is the rupture of it. And so what does the rupture of an aneurysm mean? Well, really, the first thing that happens is the worst headache of your life. The blood comes out and it pours into the space around the brain. And that can cause effectively a kind of a bleeding stroke. So this is really the thing that we're worried about, is this sort of sudden explosion, which could be so deadly. It turns out about 1% of people have an aneurysm, although many of those people will never be affected by that aneurysm. It's very small, but about 30,000 of them in the United States rupture every year, which is pretty substantial. And the chance of dying is about 40 to 50% of dying either immediately or sometime after the rupture. And that's why it's absolutely critical to get the best care. So who's at risk? Well, they can happen to anybody and really at any age. I've seen them in babies all the way up to very, very old people, but more common in people between the ages of about 30 and 60, and more common in women than in men. There are people with certain inherited disorders who can get aneurysms more, but for the most part, actually, it doesn't mean that you're more likely to have it or someone in your family is likely to have it because someone else in the family did. They're rarely strongly inherited. So what about treatment? Well, there are two major classes of treatment, and we're going to talk about one of them in more depth, and that is you could watch it, or you could do one of these two things, which is to put a clip on it, and that's in the upper image, or to coil it, and that means to go up through the blood vessels and fill them with a platinum wire until they clot off. And that really depends upon the anatomy of the aneurysm more than anything else. As far as prevention goes, there's nothing you can do to prevent an aneurysm, but you can lower your risk by not smoking and keeping blood pressure under control. So now we're going to go into seeing a little bit about what it's like to be in the operating room and how we fix it. So again, here's the picture of a normal blood vessel. You can imagine that this is how it should be. This is where an aneurysm forms. And then what we're worried about is whether it could rupture. And again, today we're going to talk about the clipping treatment, which is to go in and occlude it so that none of the blood can get to that fragile spot at the top. And then we won't show the coiling treatment, but that was an option, including for our patient, except that her anatomy wouldn't have been suitable. So with that, let's go into the operating room. So this is the operating room at Banner University Medical Center. And actually, this is the day of the patient we're going to see. So here we are looking at this aneurysm. She was kind enough to let us film. This is what it looks like. So that's the image of her head, and in the red are the blood vessels. And as we zoom in on it here, you're going to see that she actually had two aneurysms found. She had an auto accident, and they found first the one and then both of these aneurysms that she was at risk for. Now, these had not ruptured, fortunately, but she made the decision to go ahead and have them fixed. So again, here are the blood vessels in the brain. So imagine their head is in there. And this is a particular kind of aneurysm called a middle cerebral artery aneurysm, which is often fixed by clipping. So this is the kind of incision most places in the United States you'd have for this. And this is the one that we did. This is a newer kind of technique we call the mini terional craniotomy, which allows us to handle a lot less brain. And here it is. This is opening up. So this is the scalp. She's underneath there, all covered up. This is the classic craniotomy that's probably being done most places for this kind of surgery. And we're working through a much smaller craniotomy now, trying to avoid manipulating the brain so much, trying to have less impact, and making for a faster recovery. So this is the drill we use. So this drill, has the cost of the engine in this drill is about the same as in a high-end sports car. But that's because it does such a precise piece of work. And we remove the bone, and now this is what it looks like inside the brain. Now I'm going to show you some pictures, including some footage that are not of her surgery, because working through these small holes, it's hard to illustrate everything perfectly, but we are going to see her brain. In this case, here you can see that there's some blood on this case, and here are the blood vessels. Now these blood vessels are feeding the brain. Every one goes somewhere important. For the middle cerebral artery aneurysm in particular, we know that these blood vessels are out fulfilling functions like being able to move the left side of your body, being able to talk. And we're working in tiny spaces. We have this giant dome, but we're looking for the vessel that feeds this, that comes into it, so we can get control of that vessel and then find the other vessels going out of it, which we'll see in just a moment here. So here we are carefully dissecting. Now, this suction tube you see is actually a little bigger than a pencil lead in size, and the little instrument next to it is also like a pin. These are tiny instruments under the microscope. Here's one of the main blood vessels coming into the aneurysm. So that's the blood flow coming from the carotid artery. And just to put it in context, one of these little blood vessels can fill up like a liter bottle of Coke in about 3 minutes. So that could empty your whole body in no time. We're all very pressurized. So the blood is coming in here, and then we'll see in a moment that the blood goes out to these other vessels. So I feel pretty good at this point, because if we have to, we could put a little clip on it. That's not risk-free, but we'll talk about that. And then here's one of the vessels going out, this big blood vessel. Now, when you see a blood vessel that big next to an aneurysm, you know that it's feeding a good half of the side of the head. And we can't risk any of that because your brain, as you know, just try to hold your breath. It can't go without blood supply for very long. So we'll see here, we're separating out these blood vessels so we know where they are. Everything around is the brain. We've kept that vein you can see in the foreground. So again, here it is. This is how we do it. We're under a microscope working in tiny, tiny spaces. So here's an aneurysm clip. These are very, very strong. They open like this and they basically pinch off the neck of the aneurysm. So here we are under the microscope with our expert help that will reach over and hand it to us. And then we're going to advance this clip. And this one, the aneurysm is so big, we actually have to squash it down so that we can get it soft enough and pushed out of the way. And in fact, it's too big to get clipped in one clip. So we place the first clip, leaving some of the aneurysm, knowing that then we'll go and make sure everything's okay. So there's the branch looking all right. And after we've checked the branches, and here's the other side, we have to make sure that one's okay and that there's good flow. Then we come in and we shrink up part of that aneurysm with a little electrical cautery. And then we start to advance additional clips on top until we gradually squeeze away this aneurysm so that the brain can be protected from any further rupture. So here we are releasing and getting, and again, all these things are tiny, tiny spaces, but so consequential because the blood flow that comes through these vessels is what makes us who we are. So there we see the other branches wide open, and you can see kind of all those structures. Now that little star there you see is because we just realized there's another aneurysm. It wasn't visible on the scans even, but we always look around and there's another aneurysm right there. And so as you'll see now, we go inside and then advance another extra clip. This is called a mini clip. You can see it has purple on the back, and just pinch off that last thing because it would be such a shame, right, if we went in and stopped the big one and then the other one burst. And then even a very small aneurysm can burst. Keep in mind that the average aneurysm in the United States that bursts and can be fatal is smaller than a garden pea. They're just tiny little things. So here's the brain through that small opening. And at that point, everything is good. We check it to make sure the blood flow is okay. And then we close up. So here's another one. And this I wanted to show because this is actually what it looks like when there's a ruptured aneurysm. So the first thing we do is go down and look at these arteries and nerves. So on the left side, you see the little star there is on the optic nerve. So all of your vision runs through that for the entire right eye. And the other one is the carotid artery, which is the artery that you can feel pumping in your neck. But this is where it comes into the brain, where it's a few millimeters across and goes out to feed the aneurysm. We go there first, so we have control over it in case the aneurysm should bleed, because a ruptured aneurysm is much more likely to bleed. So let's keep going and we'll see that. So now we're dissecting out and finding the vessel that goes out to the aneurysm. And you can see that the brain in the front is kind of red and swollen. And that's because there is this blood that's already poured out of the aneurysm. Imagine a pipe bursting in your house and flooding the house. So now we're working in an unhappy space. But here's the vessel coming into the aneurysm. And by approaching it this way first, if worse comes to worse, we can put a clip on that vessel. But again, you can put a clip on it for about as long as you can hold your breath. You have very little time to work once you put that clip on because of the brain needing its blood flow. So we go up there, and I just want you to notice one other thing as you look at this, the yellow there, that's hardening of the arteries. We see that in a lot of aneurysms, and that area can be thick and difficult to work on because it is so tough. Okay, so we continue on now. We make sure it's all freed up, and then we go around and gradually free the aneurysm from the brain, and we have to be nice because all around is brain. So you can see it pulsing away there with every heartbeat, trying to resist us. And now we know that any point where we push on it, it could burst. So we find that in this case, it decided not to make things easy for us. The blood vessel is out across the top of the aneurysm, and the bleeding point is actually this little area right in the front. You can see, and you see a little puff of blood right there. And we know that we're gonna have to get into it. And here it is. Now it's starting to bleed from the top of it. So that's okay. At some point, I might have been concerned about it, but now we know what to do. We put something on it, and we already prepared for this moment. So we go and look down and say, okay, can we get control of this? So holding the top down with my left hand, then we slide in with this temporary clip with the right hand and stop the blood flow. Now the clock is racing, right? We don't have any blood flow to the brain on this entire area. So we quickly go and find all the parts that we had separated out earlier. So we have the two big branches coming out. We have the neck, which is that area where the dotted line is, or the dashed line that we go and get ready. And in the video, we get to pause it, which is very pleasant. But in the real world, the clock is ticking now. So we'll continue on. And we've already told the group, okay, this is the clip we're going to need. So have this clip, and then if that doesn't work, this clip, and if that doesn't work, this clip. So this is where preparation and experience really help you. We put that clip on and squeeze it down, thinking all the time about not kinking those branches. And now I'm kind of happy because I like the way it looks, and I pop that clip and then another clip. And now it's not perfect yet, but I take off the clip because I want to let the brain have a chance to breathe. And now comes the hard decision, because you see all that hardening of the arteries. If we put on too big of a clip, it's actually going to cause the inside to kink off, and we'll still have a stroke. So instead, we'd go and just get the right amount. And now we look at the blood vessels, and there's a way we can check the flow in all the blood vessels and make sure that they're filling properly. And we do that so that we know that everything's okay. So now here's our patient. We're going to see her in a little bit, but this is her brain, which you can see is just absolutely beautiful. Her aneurysm is not ruptured. So we're carefully separating out the blood vessels and these little attachments, you call the arachnoid, like spider webs, and go inside, and sure enough, here's her aneurysm. And you can see it has multiple branches coming off, and it has this little soft spot there. We get it all out. And in fact, through this little hole, just getting it laid out, we're very quickly able to get the neck out, and then carefully, same thing, pinch. Now there is the black one, is the whole vessel going out. Now, if we have a problem with this, she won't move the left side of her body. If we get the other one, she would probably have some kind of stroke that could cause a form of blindness or some other problem. The yellow one is the one feeding in, but if you preserve that and lose the branches it goes to, you still could lose it. And then this small branch in the front, equally important, because it can go to feed other things. And sometimes even a very small interruption in part of the brain can cause terrible consequences. So we're very carefully lower the clip and close it. And we go ahead and you see it closing and just feeling as it closes, and boom, there it's on. And then another clip to pinch off that last little bit there. Same thing, we're leaving a little bit of what looks like aneurysm in the front, but it's not. If we overclip that, then the inside of the blood vessel will kink off. So it's very important that we leave the inside full. And that does take quite a bit of experience and some special testing that we do. And keep going. And there are the branches. We have all the beautiful brain on both sides. And again, through that very small hole. Under the microscope, at that point, we're happy. We're happy, everything looks good. The brain monitoring is good. The anesthesiologist is good. And we have the small opening that we know we'll be able to close up. Those are the clips at the end, and we can see all the nice blood vessels all around it. So we know everything's good. This is the kind of opening that we make here. And this is a picture of someone who had a more traditional craniotomy before with a lot of brain exposed and retractors. And this is about the size of the incision versus this much larger incision. So that pretty much explains, how to do it. I'm sure everyone at home, you're ready to jump in and give this a try. I'd be happy to help you. It's always fun to watch and see it, especially when things go so well.
All right, I think that we're ready to meet Patricia now.
Yes. So one of the reasons, well, other than that she's just a wonderful person, one of the reasons why we chose our patient is that Patricia's had a very unique experience in that first she has the auto accident, and then she's found to have an aneurysm, and then she's found to have another aneurysm, and she also had some significant spinal problems. And so she's actually had a number of surgeries in our department. She's become kind of a member of the family. And if anyone can attest to the consistency of good treatment, then it's her. So I'd like to have her tell us. So Patricia, welcome, and please share your experience.
Well, thank you for having me. And I had a wonderful experience at Banner, not just once or twice, 5 times in the last year and a half, but my brain surgery. Thank you, Dr. Nakaji, for saving my life and giving me more years with my children and friends and other family. My experience at Banner was a phenomenal experience, and I have never had that before in my life at any hospital or any facility. The teamwork, the communication, when things were said, like, we're going to do this, we're going to do that, it was done instantly. And of course, when I found out I had aneurysms, yeah, I was really scared. And I seen a doctor at Maricopa Hospital in August of 2019, and he highly recommended Dr. Nakaji. So I was like, okay, so I caught Dr. Nakaji transitioning to Banner. What seemed like months and months of waiting was actually only about a month before I seen him and my surgery was scheduled. But it was the anticipation was very scary. But all the staff at Banner were very nice and respectful, and my first ICU nurse, Judy, I just remember her name. I don't think I remember what she looks like because I was really out of it, but it was all really good. And just thank you for Banner University, neuroscience especially.
Well, I mean, it's our pleasure. I think people would be interested just to know a little bit about what you think when you find out you have something like this. Like, what are your thoughts and fears?
Well, my first thought was, I'm probably going to die. That was my first thought, because all the scary stuff you see about aneurysms. And so that was my first thought. And then my second thought was, well, my kids are going to be left by themselves. And then I guess the third thought was, let's get this fixed. I want to live. I want to participate with my kids for the next 30 years, because I am 53. So
Which
I'd
is
be
very
happy.
young. I'd like to point out, very, very young.
Yeah.
What were your expectations about what the experience should be like or would be like, and what your recovery from something like this would be like before surgery?
Before surgery, the way the emergency doctor in Yuma had said, these need to be taken care of now. So I expected things to be on the ball right now, and let's get this done. I didn't think I would have to wait to see a doctor. And then when I was referred to you, that's when everything moved quickly. But that was my expectation of that. But then before surgery and after, I felt at ease because of you. And I knew things were going to get done quickly and efficiently. So I had a good vibe about you, Dr. Nakaji. So that was a good experience.
Well, we certainly got to spend some time together. I think telling a little bit about the recovery. I mean, you've had surgery on both sides of your head, both sides of your brain and everything. I guess if you turn your head, but I think probably there's not much to see, huh?
Yeah, there isn't on both sides. It depends. Like, if my hair is wet and I comb it back, you can see a little hint of scars there. But other than that, if you didn't know I had brain surgery, you would never know that they were there.
And did people know because of your shaved head?
No, I never had a shaved head.
I'm cheating a little bit by leading you. Yeah, I mean, I hopefully you felt good because you went home in very good shape.
Yeah. And I was scared of having all my hair chopped off. And like I said to you before, one of my girls was a little disappointed because I wasn't shaved, because she thought that would be really cool if mom maybe had a mohawk or something like that. But yeah, I was totally prepared to have all my hair shaved off. And I remember my first appointment with you, I was like, I don't want my hair shaved off.
Right.
And you said, no, we don't do that. So
Not necessary.
that was another comforting expression towards me. So it was nice.
Yeah, I think, you know, for us, the most important thing is you come out still being you. That's the most important thing. But on top of that, there's no reason why you shouldn't have a great experience and no reason why you shouldn't go out looking the same. It's very much within our power nowadays to do that kind of thing.
And that's nice, especially for women. Not that men don't cherish their hair either, but I don't know. I guess it's a little different.
I think it depends on their situation, probably.
Yeah. Yeah.
Well, so Dr. Nakaji, thanks for taking on this really incredible journey. And many thanks to you, Patricia, for sharing this story. I want to encourage you in the audience to please keep sending your questions. I've already seen a number of questions come across, and we're going to get to as many as we can. We're going to use now our remaining time together to allow you to ask any further questions of Dr. Nakaji and Mrs. Langell, and anything that we can't get to, we'll be posting to the Q&A section of our resource webpage at the end of the session. So I actually want to start with you, Dr. Nakaji. That surgery does not look like it's for the faint of heart. So I'm curious, what is it about Banner Health in general and Banner University Medical Center at Phoenix specifically that gives you the confidence to bring your patients here, and then I think perhaps for you, Patricia, to recommend to your community members that this is the place for this kind of advanced care? Dr. Nakaji, you first.
Well, I'm impressed by the investment that the organization has made in creating an environment in which you can do this kind of work. I've had really great experience basing my practice here, and I would never take someone to the operating room if I didn't have complete confidence that we could do exactly what we promised, which is do everything safely. But we have great people, we have great equipment, and they've invested in the technology and the people necessary and the experience to get these kinds of things done. So I have to say that I found this very, very enjoyable. I always say it's a little bit like being asked to repair a pipe when it hasn't burst and made a mess everywhere. You can go in and make it into a work of art. And I really think that has happened, and that's certainly the experience we tried to give. And I hope that's, Patricia, the experience that you had.
Yeah, it absolutely was the best experience under the circumstances. And everybody, all the way from the secretaries who were booking my surgery to the nurses, the janitors, even the people delivering food, everybody was great. And I have already, to a few people, if you need anything done, please get your doctor, your PCP, to refer you out to Banner University Hospital. Because if there's something that you need to get done, I believe you guys will be able to do it. And I'm fortunate enough to, all three of my surgeons are in the neuroscience building. So yeah, I would highly, Dr. Lee, I love Dr. Lee too. She did my back surgery and my neck surgery. And yeah, she's just as wonderful as Dr. Nakaji is. So
99% is wonderful.
Yeah, okay.
No, I would great shout out to Dr. Lee, who is a tremendous surgeon. She's one of our surgeons here. I would point out that we have specialists for each thing. So it's not necessary that I probably wouldn't do your particular back surgery that you needed.
Yeah. And Dr. Lee said she wouldn't do my carpal tunnel. She said she used to do that. So she referred me to Dr. Husta, and I absolutely respect your referral that you gave me to Dr. Lee and Dr. Lee's referral to Dr. Husta for me. So I trust you guys.
Yeah, we wouldn't send you to anybody we wouldn't send our own family. That's,
Yep.
we would want you to get that kind of care, even if we personally are not the ones to provide it. But
Yes,
yeah, but you're the living proof.
I am.
Patricia, I appreciate hearing that vote of confidence in Banner Health. And Dr. Nakaji, we're certainly very excited that you're here and that we're able to offer you everything you need to build a program like this. I want to go now to some of the audience's questions, and they're going to be for either you, Patricia, or for Dr. Nakaji. Let me start with you, Dr. Nakaji. There are a lot of people who are really interested in the details of the surgery. So it tells me that at least many of you were watching and didn't turn away. So a couple of questions about the details in surgery. Tell us about those clips that you use.
Yeah.
Do you leave the clips in permanently? Anything more that we should know about the particular equipment that you use?
Great. Yeah. So aneurysm clips are incredibly strong. I've actually been to one of the factories where they make them, and the people who make them are true artists, and they really take pride in their work. They are made by hand, one at a time. They are made of pure medical grade titanium. And the nice thing about that is they're very light and strong and easy to manipulate. They won't break. They will never lose their strength inside of the body. They will never rust. And you can have an MRI scan afterwards. It's one of the kinds of metal that allows that. So they're really a pinnacle of simplicity in engineering. And the question people have asked is, do they stay in forever? And the answer is they do. Although interestingly, I've operated on a few people who had aneurysms clip before, later for some other reason, and the aneurysm is not there. It shrivels down to almost nothing.
You also mentioned the term dissecting. So can you talk a little bit about what that means and the kinds of things that you're doing during surgery to protect the brain? You mentioned a little bit about how you think about blood flow to the brain, but I think our audience is interested in hearing a little bit more about the techniques and what did it mean, some of the things you were doing?
Sure, that's a great question. So dissection is the process of going down and separating things that can be separated safely while not hurting the other things. So it turns out to get into the head, for instance, this is somebody, and so we know the skin will heal pretty well. But as we go down into the tissues underneath, in the old days, we used to just kind of cut across things and hope it would heal. But nowadays, we actually go in and go layer by layer, separating each layer, rolling it forward out of the way, parting the muscle instead of cutting the muscle, drilling away bone, which is mostly okay to drill, but even drilling away a little bit extra bone to give us more angle so that we don't have to pull on the brain. The brain does not like having its environment disturbed. In your entire life, it never gets bashed around. It never gets deprived of oxygen. It never gets deprived of blood flow. So we can't do those things to it either, because just like someone who's underwater in a pool for a few minutes can be permanently damaged, that can happen just for us too. So we go in and carefully separate these natural planes, find the blood vessels, separate them out, preserve them, preserve the brain, preserve everything. And, there was a time when we would put in retractors and pull the brain open, all those things. And we really rarely ever have to do that anymore. So the kind of touchless, very, very cautious, careful, respectful kind of surgery, which is the kind I spent my whole career teaching now, is really what, what we did in this case too, actually on both sides.
One of our audience members is wondering if you've ever seen someone reject a clip or have any problems or scarring related to clips?
So, people talk about that, but in fact, for both surgical stainless steel and titanium, it is very rare or never that we see, rejection. The problem with clips is you have to put them on perfectly right. If you put them on too little and there's aneurysm left, it can grow again. And if you put them on too much and it kinks off the blood flow to the brain, you can have a stroke. So, but the clips themselves, if they're used properly, seem to do great.
Patricia, I think your story touched a number of our audience members, and there are several people that want to hear a little bit more about the recovery. We have a ICU nurse manager who's watching tonight and would love to be able to take this story back to her team. Can you share anything that you remember about your surgery, maybe about your ICU nurses? The kind of work that Dr. Nakaji and the team does can only be done with the amazing nurses and therapists and other clinicians who help support us. So is there anything you can share about your experience here and really focus on the nursing?
Wow, the nursing. It's just Tammy, Dr. Nakaji's nurse. Oh, I love her. She was always in there coming to see me. How am I doing? In fact, all the surgeries that I've had, except for the last one, she'd go walking by and she'd see me and she's like, Patty, how are you? But the ICU, the only one that I remember is, and that was the first surgery, and that was Judy. And she was just very attentive and coming in and looking in on me. And I was in and out of it the whole time I was there. And just the nurses are the heart of the hospital. So not to be any thing towards the doctors or anything, but the nurses are the ones that are mostly there for us. And most people do appreciate the nurses, and we love our doctors and thank them for everything that they do for us. But the nurses, they come and check on us, and the doctors are busy and in surgery and stuff like that. And not that the nurses aren't busy either, but yeah, the nurses were great at Banner, all of them.
Yeah, that is so true. We really could never do what we do without such incredibly good nursing. I love your cat.
Yeah, who's the guest star there,
Yeah.
Patricia? And actually, you know, so your cat walking across the screen really leads me to this next question.
Okay.
We've been talking about you and the impact on you that these surgeries have had, but I'm sure that there's a family, there's friends, there's clearly a cat in the background. So can you talk a little bit about what this is like for your family? And what would you share with our audience that they might want to know if they're ever in a similar situation from a perspective of their family and loved ones?
Well, I was very lucky to have my mom there, who Dr. Nakaji met on several occasions. She was there for all my appointments, my surgeries, and my girls, they were still in school and they were going to school and looking after each other. And when I came home, they helped look after me too. But my mom is the one that I was very fortunate to have my mom there. So I love my mom. She's a good person. And she looked after me. She was very, very concerned that she was going to lose me. So, yeah. And I just think that families should, in situations like this, stick together and do what's best for each other, and especially life-threatening illnesses or, you know, like aneurysms. And yeah, I just stick together. That's what I say.
Mm-hmm. Thanks, Patricia. Dr. Nakaji, a number of the audience members are wondering, do you remember how long Patricia's surgery took, or how long a typical aneurysm surgery takes for you to perform?
What I always tell people is it takes as long as it takes. We don't, I always say, if you want us to rush, we're happy to talk to you about it. But in fact, most of the time, these surgeries are a couple of hours long. It takes a little longer with a ruptured aneurysm. But occasionally with really a giant aneurysm, difficult one, it can go on for, 8-10 hours. So it really just depends on the kind of aneurysm. And that's even though you're truly working on a tiny area. I mean, the area you're talking about might be this big. And yet, all that work has got to be so fine and perfect that it can take, a long time. That's okay, though. We don't mind long days.
Patricia, how long were you in the hospital?
The first time I was in there 9 days. And then the second time, I think it was 4 days. And that was I had the second surgery November 6th. And I got out of the hospital and I went to Mexico for Thanksgiving at my friend's place in San Felipe. So yeah, I was good to go.
Sounds like you keep getting better at this.
Yeah.
Several members of our audience are wondering if you have any restrictions now. Are you able to do the things that you want, or has Dr. Nakaji advised you to avoid certain things like exercise or hiking or other kinds of activities?
No, no. There's no restrictions.
Cage fighting, no cage fighting.
No.
No cage.
Yeah.
That probably applies whether you've had an aneurysm or not.
Yeah, and I don't go off-roading anymore either, because that's how I got into the accident. It's like a happy accident. I rolled a razor 3 or 4 times. And I kind of lost consciousness. Well, I guess I did. But I was fine. I had a cut on my elbow from the windshield. It actually, if it wasn't for my dad, he made me go to the emergency room and get checked over, and they did a CAT scan, and that's where they found the 2 aneurysms.
Yeah, I
So,
think it's really important to understand the difference between a ruptured and an unruptured aneurysm, because once you bleed, everything changes. The brain swells shut. The aneurysm can bleed again. There's that chance of simply swelling and dying, a chance of stroking, and fixing the aneurysm becomes immensely more difficult. And many people are in the hospital for many, many weeks and can spend years, getting better. So being able to fix the aneurysm before that happens really is important. And it's not necessary for every person. We see people with very tiny aneurysms. We know the percentage risks, but for certainly someone of your age who has a lot of years to go, leaving your aneurysms in place would not have made any sense. I would hate to have seen you come back as one of those people with a terrible rupture.
and I am so happy that, because let's say if that aneurysm would have burst, like if it did during the accident, I would never have known. I would have just thought I hit my head and had a really bad headache. I would never have known unless I had that CAT scan.
Right.
That's another thing I think is important too. CAT scans or MRIs are not like mandatory in well checkups for people. And I know they're expensive to have, but I really do think people should get them every once in a while just to make sure everything's good. And I would never, if I hadn't have gotten into that accident, I would never have known that I had aneurysms.
And so now thinking to the future, Dr. Nakaji, can you talk to us a little bit about the risk of recurrence or new aneurysms in someone who's had them treated before?
So that's one of the great things about the clipping procedure, is that the risk of recurrence for her aneurysms is almost negligible. Once you have them clipped, if they're clipped properly, and we have scans showing that they all are, the chance of it becoming a problem again is minimal, and the chance of her forming a new aneurysm at this point in her life is also minimal. So that's the great thing about it, is you can really go to bed at night knowing that from here on out, this is just simply not a problem.
So Dr. Nakaji, go ahead, Patricia.
Well, I'm happy that they don't come back.
Yes.
Very happy.
So Dr. Nakaji, one of your former patients is in the audience and was asking, I think, a little bit about how things have changed over the years in your field in neurosurgery. You spoke a little bit about using smaller incisions or finer techniques. Can you talk to us about research that's going on and perhaps things that you're involved with to advance the science of neurosurgery and how we do this to make it easier for our patients and also better for our surgeons and other clinicians?
Yeah, absolutely. I think it's really important to understand that this is a dynamic field. So there's a whole nother area we could talk about, which is the endovascular repair of aneurysms, which is the other way to fix them, which is applicable to many kinds of aneurysms and is being performed at a very high level here at this institution. But clipping has not stood still. When I started, we shaved the head, we made gigantic incisions, we cut across the muscle, we retracted on the brain, and we didn't have these rapid ways of assessing blood flow we have now. One of the areas that in my research we pioneered was seeing the blood flow through the blood vessels by giving a dye that causes the blood vessels to light up under the microscope. So we don't have to wait for an angiogram, and we can catch a block, while you're still sitting there on the table before any stroke can happen. We have ways of monitoring the brain now, improving anesthesia, improving brain recovery. So there are really a lot of things that have happened. But those things didn't happen just because we sort of thought of them or wished for them. They happened because a lot of hard work went from many people. And just as you point out, in the hospital, the nurses are sort of our heroes. There's a whole cast of other people that go to making improvements in surgery. And it takes a lot of people really stopping and thinking. And whether that's in the lab or modeling things on the computer, there's a lot that goes into it. We actually have 2 visiting scholars right here in the department now, one of whom did the illustrations that you saw of aneurysms and of the incisions, who's a talented artist, and another one did the video editing, who are working on advances along with us. We have a visiting fellow who's spending time with us learning advanced techniques. We have a resident with us learning advanced techniques. And we're working with a whole group of other researchers to try to move forward this area, and not only this area, because at this point we have initiatives in spine surgery and brain tumor surgery and all these other things. So I think it's really important for everyone to understand that in an academic environment, perfection in what we do is a huge part of it, but getting better is equally important, and teaching people to get better. So it's not just me, it's not about me, it's about the whole environment getting better so that people everywhere can be better.
And so pull out your crystal ball for me. In 5 to 10 years, how is this surgery going to be different? How will this disease be treated differently? Do you want to put a stake in the ground and let us know what you predict?
Yeah, I think that we're going to see big improvements in the endovascular treatment. So some patients won't have to have any opening at all, and will go up inside and repair it from within. I think that we will see better even openings, smaller openings, and more careful openings even than we have now. And to say that is not to say that we're not way better than we were even a few years ago. It's to recognize that we can always get better. I also think we're going to see improvements in imaging and biology. So we can look at one aneurysm and say, probably this aneurysm is not a high risk. You should go live your life and exercise hard and do whatever you want, and tell another person, you really should have this fixed. And I think we'll see that happening in a whole lot of areas. One thing I can promise is that we won't stop trying.
So Patricia, I want to come back to you. Several of our audience members want to know how you feel now. And do you have anything left over from this surgery? What's life like today?
Well, I think I feel pretty good. I don't think there's anything left over from the surgery. I think I'm pretty good. I try and exercise my brain every day. I play Words with Friends 2 every day, Scrabble. And I do crosswords and stuff like that, just try and keep my brain active, and tried to learn how to play Sudoku, but I'm not really good with numbers, but my kid's looking at me like, what? But yeah, I think I feel pretty good. It'll be 2 years in October since the first one. So I think I feel pretty good.
Amazing. You've both clearly inspired our audience just looking through the comments tonight. Dr. Nakaji, what inspired you? Why did you decide that this was going to be the path that you would follow in life?
That's a really good question. Since I have run training programs for neurosurgeons, I've gotten to hear thousands of people now talk about why they might or might not want to do brain surgery. And I've had a chance to reflect on my own motivations, but I find people fall into a couple of categories, and I certainly fall into one of them, which was somehow I always knew I wanted to do this. And I just was lucky that there was a time in history where there was tremendous growth in the field. And so not only did I get to do it, but it has literally changed around me, and I've gotten to change with it to make the field better the whole time. But I think it has to do with a fascination with people, really caring about how they do, realizing that, the brain is the most wonderful thing in all of creation. There's actually no more organized piece of space in the known universe than the part between your two ears. And the chance to work on that and protect it is something that for me has just been an incredible privilege.
You've talked a little bit about where the field is going.
Mhm.
Can you talk about your vision for neurosurgery and neuroscience at Banner at large, and specifically here at Banner University Medical Center, Phoenix?
Absolutely. So it's definitely, I mean, Phoenix is the 5th largest city in the United States, it's certainly a leading place. And it's my belief that here at this institution, there's no reason why we shouldn't be practicing the highest level of neurosurgery and giving the highest level of neurology care in the world. There are a lot of pieces that go to that, and we're working to perfect them. And then partly because of the scale of Banner and the way that the company is so well integrated, there's no reason why you shouldn't get that level of care everywhere you go or be fed into somewhere that can give you that care. So it doesn't become just a chance of who you happen to get or when you happen to get it. There's a organized, thoughtful system to give you the very best outcome for whatever problem you have. That is certainly what we envision. We certainly envision adding more and more research. We don't want to be following the field. We want to be leading the field. And then there are other things that patients really need. And I think, for Patricia, we really had a chance to see what are the parts of support that can go. And in fact, I've asked her whether when we have an aneurysm support group meeting, if she will come and share her experience and learn from other people and teach them. And that kind of thing, which is bringing together all the facets, the really great clinical care, the system organization, the research piece, the academic and teaching piece. So I don't want to finish my career and know I didn't leave behind people who are better than me. I certainly hope that happens. And then the community piece and the family piece and the support, recognizing that you're part of a family and we want you to thrive within that and that they have to be taken care of too, and part of a whole community. I see us leading in every one of these spheres.
Thanks. We're coming close to the end. I feel like we could be talking about this all night, but what I want to do before we leave, Patricia, is give you a chance to leave us with any closing thoughts or comments, anything that you want our audience to hear or know as we begin to wrap up this evening.
I just say keep up with your wellness checkups, stay on top of your health, yourself, and if you feel something's out of sort, pursue it. Don't give up, and just seek the best medical professionals that you can, like Dr. Nakaji. Banner University care, that's what I say. If I need a referral, I'm going to Banner. That's where I'm going to go. But thank you very much.
My pleasure.
Thank you, Patricia. Dr. Nakaji, let me give you that same opportunity to leave our audience with a few parting thoughts.
All I'd like to say is, we're really here for you. We're here to give you the chance to have a better life, and whatever we can do to keep advancing the field, we want people to be proud of what we can bring, and we want to hold ourselves to a very high standard to bring it. Everybody is different. I visited once, a Boeing factory, and they bragged about how they had these incredibly complicated airplanes. But I said, well, we've got 7 billion different airplanes, and every single one of them is in a different place. So humans are so unique, but I really think that you can expect great care and advancing care and the best care here.
Thanks, Dr. Nakaji. And to our audience, I want to thank you. I apologize that we weren't able to get to all of your questions, but we will be posting answers to all of those on the Q&A section of our resource webpage. And certainly, I would be remiss if I didn't take a moment to underscore how instrumental philanthropy is to our work here at Banner University Medical Center, Phoenix. It supports all of our high-touch, high-technology programs. As a nonprofit organization, we invest our proceeds back into providing the programs and services that our patients and communities need. Donations allow us to provide patient assistance, they advance our research initiatives, and enhance our ability to serve patients and families. If you're interested in making a donation to the Banner Health Foundation in support of Dr. Nakaji and his team in the Neurosciences Institute, there's information on the resource webpage to help you do so. I want to give a special thank you to Hazel Richards and really the entire Banner Health Foundation team for organizing tonight's conversation. We really appreciate the opportunity to spotlight this amazing and life-saving work that's done in the neurosurgery program at Banner University Medical Center, Phoenix. Thank you so much to the sponsors of the At Home Together series, Prisma and Nuance Communications. And especially thank you to the employees and medical staff members of our campus who every day perform miracles like you've just seen tonight. Most importantly, thank you to Patricia and all of our inspiring patients and your families. We're honored by your trust in us. And thanks again to everyone who participated tonight. Please stay safe and good night.
Good night, and thank you again.